The Grace Centre for Newborn Care welcomes you and your baby.
The Grace Centre for Newborn Care is situated at the Children's Hospital at Westmead, and it's a very specialised newborn intensive care unit.
We hope that this DVD gives you some insight into the care your baby will receive and the support available for parents.
We see really sick babies and it is overwhelming for parents.
We try to make it as comfortable and as homely for families.
The reassuring thing for the parents is that they're in the absolute best place for their baby at that time.
Our philosophy, which we really try to practice, is that the family is part of the team that look after the baby, and we try to practice family-focused care.
Parents are welcome to be with their babies at any time of the day or night.
Before Lola was born, we came in for a visit and things were explained to us.
Every day they come and see me, come and speak to me, the nurses, the doctors. We know each one by first name basis.
And we've had a lot of opportunity to ask questions.
There's two babies in a room in with you to go home.
Is there anything that we need to prepare?
We work right from the beginning as a team to link in with the parents and to make them as comfortable as possible.
They haven't done something without telling us and talking to us about it.
It's a fantastic unit.
Today is much better. He's still on CPAP, 6 centimeters. His tummy looks good.
Great.
And he's been coping, handling well.
On arrival at the hospital, go up to level 3.
Your baby might have been referred because they have a surgical condition or have a heart problem or have a complex medical condition that requires all the specialist facilities that are present only at a children's hospital.
Hi, can I help you?
Hi, my name's Ren. I came to see my daughter Nikki.
The parent worries about two things. First of all, they're worried that the baby's going to die. And secondly, they're worried that the baby might be left with some significant disability. And these are very real concerns. Both of them are unlikely.
About 15 years ago, the mortality rate in Grace was nearly 20%. Now, thanks to the coordinated effort of all the doctors and nurses, the mortality rate now is under 2%.
Hello.
At the reception desk, you'll be greeted by our secretary.
Hi Rena, Nikki's in intensive care. Would you like me to take you down?
Past the reception desk on the right are lockers for families. We ask you to leave your belongings here.
Because the babies who come to Grace Intensive Care often have problems that involve more than one system of their body, there are many people involved in their care.
There is a big team who will look after your baby. So that will include the neonatologist, who will coordinate the care. You may have a surgeon or other subspecialist pediatricians. We have a social worker, occupational therapist, physiotherapist, feeding specialists, and all of these people are really integral to the care that we provide.
We're just waiting really on the CT result.
There's 90 nurses here in this unit. We have nurses that are clinical managers, clinical nurse specialists who are senior nurses, and then registered nurses.
It's been a very difficult time because we're very unsure as to what our child's needs were, and it's been explained quite clearly for us and felt very supportive.
We encourage families to be with their babies as much as they're able to, but we understand that they do have other responsibilities such as caring for siblings at home.
It's been a bit tough running around from hospital to hospital and trying to dedicate enough time to each child.
The level of care and professionalism of the staff helps with your nervousness of being a new parent.
And if you're not here, they can ring you, or you can ring at any time as well, which is fantastic.
If friends or family also want to visit your baby, then that's absolutely fine.
His grandparents come in and see him all the time during visiting hours.
Grace has an intensive care unit as well as a high dependency unit.
It is very important that everyone wash their hands when entering and leaving the ward, including small children.
The intensive care unit is extremely busy. The babies come in and need urgent attention.
35-week premature baby who had respiratory distress after birth for today would be to extubate to low flow oxygen if he needs that.
Some of the babies do require to be put on a ventilator, which is a device that helps the baby breathe.
When they come through that door, there's a lot of equipment, a lot of lights. Sometimes you might hear an alarm going off.
218?
Yeah.
Okay. So the plan is tube out, wait a couple of hours, 30 mils per kilo, feed third hourly, going.
Many of the babies who come to Grace require a major surgical operation during the first few days of life. The neonatologist and the other staff in Grace will explain the procedure to you, and then the surgeon will come, explain the procedure in detail, and then you'll be asked to sign a consent form. So Daniel, as you can see, is in intensive care. He's had surgery. He's fully monitored, and that monitor behind. We do ward rounds twice a day. Then there's always an opportunity for you to really be involved in the care.
Very much so, I love it.
The results in Grace are excellent for surgery.
In the intensive care unit, every baby is allocated a nurse who cares for the baby and parents during their shift.
The staff are very conscious about explaining procedures, explaining the equipment.
This is Hudson. He's 5 weeks old and he has Hirschsprung's. So he wasn't the typical Hirschsprung's baby. He was very hard to diagnose. Eventually we got there and he had surgery and he's much better. He's doing really well.
We're very mindful of babies' distress and of the distress of families, and we organise a unit that tries to minimise all of that.
Seeing just the magnitude of how it works, I've been overwhelmed. It's been excellent.
We give the babies quiet time between 12 and 3 each day.
During quiet time, we close all the blinds and dim the lights.
We reduce the activity during that time, keeping it for just the babies and their parents.
One of the nurses started a diary for him, and it has photos of him.
His medical attachments.
Yeah, and what they were for.
Every baby has a diary. It becomes a record of your baby's journey.
I've added a couple of pages to it as well.
There you go. We encourage parents to do as much caregiving as they would like to.
I change his nappy and I clean his eyes, his mouth.
Alright, you can pop him over. We're able to change his diaper, and we've been taught about the tubes that are high-risk tubes that you don't want to touch, and then the other ones that are fine to move around.
I had an opportunity to have the cuddle and just sat in my arms. The staff were fantastic, shifting him with all his wires and tubes.
Okay, hi Mum. And I'll bring that elbow in.
Human contact is important for the well-being of any baby.
The first couple of days I just sat next to him and held his hand, and he clutched on tight.
Hey baby. Wakey wakey. It's really nice to have some kangaroo cuddles.
Often I talk to families around your baby knows your voice, they're reassured by your presence, the touch that you provide is very different to the experience that they're having with all of us that are working with their baby.
And this is for his antibody? Yeah. When's that stop?
Friday. The social worker reached out to me when we first got here, and I reached out to her again after his first surgery.
He's doing well, like as everyone expected.
Better than?
She was really good to motivate you and remind you you're being a good parent and doing everything right.
How do we introduce the baby to his siblings?
It's really helpful knowing that I can speak to her and know that she understands me.
And just going through some of the photos that you have and just saying, look, this is how big he was when he was born and this is where he's at now. The social worker is also providing practical assistance with accommodation, parking and those types of things, which become quite overwhelming for families when they're under huge amounts of pressure.
That's a good idea. I haven't shown him the scrapbook.
It is important to take a break. There's a parent lounge and courtyard. You can try one of the cafes in the hospital or take a walk in the garden.
It gives you a bit of normality than being inside and seeing your child hooked up to lots of tubes and things.
There is also a library where parents can learn more about their baby's care and specific medical conditions.
So I'm just going to put a cannula in for his antibiotics.
A baby who needs more specialised nursing care but doesn't need the intensity is then transferred to what's called high dependency, where they are cared for in a more relaxed environment but no less observant in the way that we would care for them.
In this unit, the parents are able to interact with the babies more and provide more of the care.
Chance is in an open care bed, so he's got some nesting here. He's actually waking up a little bit just to support him, so he pushes against it just like he would when he was in utero. He's got a feeding tube in his nose to help him feed. This is our IV pump, and it's got something called TPN, or total parental nutrition, fats and sugars to try and help him to grow. He's also got some supplemental oxygen, which is just helping him breathe.
Every baby is attached to a monitor. If the baby's signs go out of the normal range, alarms will ring to alert staff.
And alarms are used to anticipate a problem, not because there is a problem.
This is our monitor that most babies have. So along the top is heart rate. The yellow squiggly line, that's to monitor how many breaths he breathes in a minute, and the light blue is to monitor his oxygen saturation, or how much oxygen's going around in his blood.
3.9. Yeah, he's finally put on weight.
We have a developmental care team here who work with the babies and their families.
That consists of our occupational therapist and physiotherapist, social worker, together with representatives from the nurses and the doctors, and we meet regularly.
The babies have an individualised care plan. It's kept in the green folder at the cot side.
At the moment you're giving her cuddles. Have you bathed her yet?
Yeah.
Babies are very communicative. They can cry, but they can also give us other behavioural cues. Our occupational therapist and physiotherapist will come round and look at her. Part of developmental care is working with the families to teach them to read those babies' cues.
Some of the babies obviously are breastfeeding or bottle fed, but some babies can't feed and they're fed through a tube, and that's a way that the parents can also assist.
I'm able to breastfeed Isaiah now, and they encourage that from about the 4th day.
The lactation specialist will help mothers with breastfeeding and expressing milk for their baby.
There are 4 expressing stations here. Part of my role is to support new mothers that come into the unit with breastfeeding and expressing, and that can be with problems or issues they may be having.
Before Lola was born, I met with the lactation consultant. We sat down and we discussed what the options were, and I actually expressed before she was born and stored the milk here, and then it's been ongoing support once she was born.
Is there any talk of home?
Lisa actually said maybe Friday, so depending on his antibiotics.
Sounds good to me.
We talk about discharge throughout the whole journey.
Just need to complete the antibiotic.
It's going to be strange having him at home and not 24-hour care, but it'll be delightful.
My job is to help parents to go home with their baby. Benjamin has only had a short stay. Basically, he's had his operation. He stays with us for 24 hours and then we get him back to his hospital of birth. The surgeon wants to see you in 4 weeks' time. I've helped mum and dad on any special precautions that they need to take.
There's a lot of planning and negotiating that is involved in discharge.
We can take the dressing off ourselves. I link them in with community nurses and arrange their follow-up with GPs, paediatricians. If you have any problems with the wound, just give me a call. Thanks. Part of my job is to help them to feel really supported and feel comfortable about taking their baby home.
We do have a newborn follow-up growth and development clinic, and we do assess baby's progress.
How is she? Is she going well?
Yeah, she's had a stable night.
The majority of families who come through will find a silver lining to the experience, even though it's troubling and traumatic for them.
It's been a good experience, considering where we are.
Just seeing him holding my wife's hand the way he does, it's a great feeling.
If you have any questions or concerns, please talk to us.
More oxygen with him.
The baby that's down in the HQ that's going home today, is there anything that we need to prepare?
Yeah.